Ladies and gentlemen, esteemed guests, and distinguished colleagues, welcome to the 42nd Annual PSA Conference of 2024. Before we commence our session, let us begin with the recitation of the Holy Quran, led by Dr. Nasir Khan from NICVD, followed by the national anthem.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم أفحسبتم أنما خلقناكم عبثا وأنكم إلينا أفحسبتم أنما خلقناكم عبثا وأنكم إلينا لا ترجعون فتعالى الله الملك الحق لا إله إلا هو رب العرش الكريم ومن يدع مع الله إلها آخر لا برهان له به فإنما حسابه عند ربه إنه لا يفلح الكافرون وقل رب اغفر وارحم وأنت خير الراحمين صدق الله العظيم.
I would like to request everyone to please stand up for the national anthem. We are honored to inaugurate our 42nd Annual PSA Conference, and it is my pleasure to invite the President, Dr. Shabbir Jubani, to deliver the welcome address. Dr. Shabbir's dedication and leadership have been instrumental in shaping the direction of our organization. Sir, please come on stage.
Bismillahirrahmanirrahim. Assalamu alaikum and good morning. Honorable Chief Guest Dr. Saad Khalid Niaz, Guest of Honor Dr. David Pilcher, distinguished guests and dear colleagues, Assalamu alaikum and good morning. I feel humbled and I am grateful. It is an honor for me to welcome you all to this wonderful event, that is 42nd Annual Conference of Pakistan Society of Anesthesiologists, Karachi chapter. Pakistan Society of Anesthesiologists is the oldest and the most vibrant societies among the medical fraternity. We held our academic sessions on regular basis, including CMEs, seminars, and online lecture series. This will be our fourth season of online lecture series, which are held on fortnightly basis. It gives me immense pleasure to welcome Dr. Saad Khalid Niaz as our chief guest. Currently, he is serving as Health Minister in current caretaker setup of Government of Sindh. He is a gastroenterologist as a specialty, and as you all know, he is considered an authority on it. Recently, he has established Sindh Institute of Advanced Gastroenterology, which provides free of cost medical treatment, particular gastroenterology, to all the patients. I feel honored in welcoming Dr. David Pilcher as our guest of honor. I don't think he's here. Thank you. Dr. David Pilcher is an intensive care specialist at the Alfred Hospital in Melbourne. He trained in respiratory and general medicine in the UK before moving to Australia in 2002 to undertake training in intensive care medicine. His interests include organ donation, lung transplantation, ECMO, severity adjustment of ICU outcomes, ICU performance monitoring, and the epidemiology of intensive care medicine. Currently, he is the chairman of the Australian and New Zealand Intensive Care Society, that is ANZICS. He runs a binational critical care registry as well. He is also a clinical professor with the Department of Epidemiology and Preventive Medicine at Monash University. I welcome our distinguished guests who have come from across the country and abroad as well. And last but not the least, I will be failing in my duty if I don't welcome all the participants. Without their participation, this event would not have been possible. I also welcome the representatives of pharmaceutical companies whose financial support is integral, in organizing these type of events. Thank you very much. Thank you.
Thank you, sir. Throughout the year, our activities have been meticulously documented, and to present the report, I would like to call upon stage Dr. Asma Abdus Salam, the General Secretary of PSA.
Assalamu alaikum, everyone. Respected Chief Guest Dr. Saad Khalid Niaz, Guest of Honor Dr. David Pilcher, Vice President ANZIC, Patron PSA Professor Tipu Sultan, Patron PSA Karachi Dr. Saida Haider, President PSA Karachi Dr. Shabbir Jumani, members of the Cabinet and Executive Committee members, dear colleagues, ladies and gentlemen, again a very good morning to you. I'm honored to present the annual report of the Pakistan Society of Anesthesiologists Karachi chapter for the year 2023 and 2024. The objectives of the Pakistan Society of Anesthesiologists are to make available the highest standards of anesthesia, pain management, and critical care. To have competent anesthesiologists, we need to have good training programs and continue the medical education, and PSA Karachi's commitment to academic excellence and professional development has remained steadfast during this period. Efforts such as PSA Karachi online lecture series, as Dr. Jumani has just mentioned, which was initiated back in 2022, have continued to thrive throughout 2023 and beyond, facilitating the knowledge dissemination on global scale. The primary goal was to educate the anesthesia community, especially the trainees, with the evidence-based practices, recent guidelines, and practical applications of their existing knowledge on different topics in anesthesia, critical care, and pain management. We successfully conducted 4 online lectures sessions with 48 lectures up until now, each drawing more than 60 participants. The overwhelming response from the participants prompted us to rectify the errors and delays in communication and the overall conduct. These sessions have been uploaded on YouTube channel, ensuring accessibility and knowledge dissemination beyond geographical boundaries. Through these online lectures, we established the collaborations with our professional societies across the world, including the American Society of Anesthesiologists, Netherlands Society of Anesthesia, and now NZEC, besides having participants from Myanmar, Saudi Arabia, Kenya, Ireland, Nepal, Nigeria, India, and Bangladesh, showcasing its global reach. We worked on improving communication with the existing members through regular newsletters, email, social media, and website updates. In 2023, PSA Karachi released 2 newsletters which were meticulously put together and contained a lot of information covering a wide range of topics relevant to the anesthesiologist's interest and the professional development. In our commitment to raising awareness about the critical healthcare issues, we observed World Sepsis Day with a maximum participation from our members in September. All of these events were well attended and received the positive feedback from participants. PSA Karachi has actively been engaged with the community through various initiatives. We celebrated World Anesthesia Day in Mithi Tharparkar, our district of Sindh, with a series of events, including a press conference, a walk of awareness to NICVD, emphasizing the critical role of anesthesiologists in healthcare. Additionally, we also inaugurated the Tharparkar chapter of PSA, extending our reach and impact to the underserved areas on 15th of October 2023. Ladies and gentlemen, now just to brief about this annual conference. We had several meetings and informed meetings to organize this annual academic activity. For this conference in particular, we conducted 7 general meetings and ensured that all activities were meticulously planned. As you know, the theme of this conference is Safe Anesthesia Practice in Varied Healthcare Facilities. This theme reflects that safe and quality practice is much needed at this time. As part of our pre-conference activities, we organized 11 workshops in collaboration with different institutes across Karachi. These workshops received enthusiastic responses from residents. Faculty members from various institutes delivered structured and skillful learning experience to the participants, and these workshops were on basic cardiac life support, which was held in Hamdard University, ventilation in ICU at Jinnah Medical and College, ultrasound-guided blocks at Civil Hospital, Karachi, ultrasound-guided arterial CVP line at NICVD, and advanced airway at Indus Hospital. And we also have a few post-conference workshops coming ahead. We have upheld our tradition of maintaining a very nominal registration fee, making our society accessible to all. Despite financial challenges, as you all know, we have been able to gather many colleagues for this academic purpose. PSA Karachi is one of the few societies in the country that actively promotes research at the junior level. We recognize and celebrate the excellence by awarding a gold medal to the trainees for their outstanding research contributions, along with the prize money for the second and the third runner-up in both free paper and poster presentations. Today and tomorrow, you will have full conference sessions, which will include a consensus conference, panel discussions, lectures, sessions on free papers and posters for junior researchers, and much more. I hope all of you will enjoy these 2 days by sharing and learning the science of anesthesia. I'm thankful to all the speakers, expert panelists, and moderators for coming here and sharing their experience, knowledge, and skills with you all. Thank you, and have a very good conference.
To brief us regarding the scientific program, I'd like to call the chairperson of the scientific session, Dr. Mohsen Nazir. Dr. Mohsen Nazir is assistant professor at Department of Anesthesiology, Aga Khan University Hospital. He is the director of Anesthesia Research Cell, member of the Medical College Research Committee at Aga Khan University. Sir, please.
Assalamu alaikum. Good morning and welcome you all in the 42nd Anesthesia Conference, Karachi chapter. So before beginning the overview of the program, I would like to thank my other member of scientific committee, Dr. Tariq Aziz, and my senior advisors, Professor Saida Haider and Professor Fawzia Anis Khan. With their continuous guidance, we were able to develop this program. So this is a 2-day conference with 10 sessions and 1 parallel session for paramedics. In the first day, after inaugural, we have 4 sessions, including 3 thematic sessions related to pediatric anesthesia, obstetric, and 1 panel discussion about the blood transfusion. And 1 thematic session in the afternoon would be related to the complex clinical diseases. In the second day, Sunday morning, we will start with a breakfast session. The breakfast sessions are actually, these are formally informal group discussions. And we have 12 group discussions over there from different areas of anesthesia, pain, and intensive care. So the members are the lead of the table from all over Pakistan, and they are leading the table of these areas. And then we have, tomorrow we have case-based discussions. We will have 2 case-based discussions, one related to critical care and the other one related to pain management. Then we have a panel discussion related to anesthesia residency programs in Pakistan, the updates and the area of improvements. Then we have pro and con debate about the artificial intelligence, the role of artificial intelligence in healthcare and research, followed by the resident free paper contest and the poster presentation. And one more thing is the parallel session for the paramedics also, for anesthesia technicians and nurses. So one more important thing is that each session will be followed by a QR code. You will be shared a QR code for the evaluation and CME credits. So if you attend a session, please scan the QR code and fill the evaluation form for your CME credits. And the last but not the least, this is your conference. Your presence in the conference is honor for us, all of you, especially the chief guest and the members of the core committee and the senior colleagues and our junior members. So we expect your maximum participations in all the sessions ahead today and tomorrow, inshallah. Thank you very much.
Anesthesia safety goals in limited resource settings present a unique challenge that require a special skill set and collaborative effort. It is my privilege to introduce Professor Tipu Sultan, a distinguished figure in the field of anesthesia, who will share insights from his extensive experience. Professor Dr. Tipu Sultan's pioneering work in establishing critical care units in government institutes with limited resources is truly commendable. Sir, please come on stage to commence your session.
Thank you. Thank you very much. Thank you very much for inviting me to talk a little bit on safe anesthesia practice in varied healthcare facilities. There will be some surprises, but they're all ground realities. I must congratulate the scientific committee for making such a wonderful program, which I have seen after a long, long time. My congratulations to Shabbir Jumani and Asma for organizing this 42nd Congress, which is a regular feature in our country, and I am so proud of that, along with our all senior colleagues. I would like to welcome my colleagues from Lahore and other parts, Peshawar, who have joined us for these 2 wonderful days, which is known as Talim-e-Balghan or CME or CPD or something like that. But again, with all these, it is a wonderful social occasion also. Well, this talk will show us ground realities. We all work here in Pakistan, in Karachi, and other parts of the world. And of course, yeah, there are few fortunate people in this room who work in this country, Pakistan, and who work as a locum or regular jobs abroad. Western world, a different world, and then backyard countries, Saudi Arabia, Qatar, and all these, Dubai, Sharjah, a different world again. From anesthesia point of view, I will confine myself to the anesthesia field only. And when I visit these places, then again, there are two feelings at that time. When I visit underprivileged places in Karachi, in Pakistan, from rural Sindh to Gilgit, Baltistan, there also, then two feelings. That on one hand, we are so unfortunate that we haven't got all these goodies. Wonderful drugs, wonderful machines, which were just unthinkable 40, 50 years before when I started my anesthesia at Charing Cross. Unbelievable. Those drugs which we used at that time are obsolete at this moment. These wonderful machines, equipment, which will tell you saturation, blood gas, this and that, in seconds, was unthinkable. So on one hand, we are so fortunate at this moment that all these things are here. Same time, I get a feeling that we are so unfortunate that in the periphery, or right here in Karachi or Lahore and Peshawar also, there are places in which nothing is available. Just nothing. And patients are treated. My salute to all those experts, MCPS, FCPS, or other qualification, that they are managing these patients. They don't let them die. Because I'm practically there with all these things. So, when I asked one of my colleagues to look out that what is this safe anesthesia practice? So that colleague came out, they went to the Google search, because there is a lot of search nowadays. So we learned that presence of a trained anesthesia provider who has access to appropriate drug. These appropriate drugs were not available many years before. Equipments, wonderful equipments, facilities. And then on top of it, he is blessed. He is blessed with a trained anesthesia assistant. Trained assistant is a God's blessing. May it be a surgeon, may it be our chief guest, gastroenterologist. When I see him working, doing endoscopy and especially taking out a stone from the common bile duct and pancreatic duct, he is so dependent on his assistant, because he is watching that, and some assistant is providing him few this thing, and on the flick of his finger, or just a little murmur in the air, and he gets a proper equipment by a proper person, and he removes that stone sitting in common duct, which has made the life miserable of that patient. And that's it. The bile keeps on moving, and the patient is fine. So God's blessing is an assistant. Anesthesia anesthetist, we lack it. There is very shortage of anesthesia technicians, lot of reasons. We would love to have that, because if I have got a good assistant with me, so I am blessed. But there is something to note down. Again, ground reality, that the mortality because of this facility is so horrible to even read. In developed world, it is 1 in 250,000, and in our part of the world is 1 in 300. So out of every 300, one is little bit unfortunate or something like that. Something to ponder about, something to think about as a facility. And why it is so? Health remains a neglected issue in low, middle income countries. And that is the battle we are fighting at this moment, facing at this moment, along with our health minister and other people, that it is a neglected issue at this moment. And we must realize that all the stakeholders, you and me and other people, they must realize that safe anesthesia is a basic fundamental right of every patient, me and you. I have been a patient many times going through surgery, and a lot of you people also. And safe anesthesia means patients of all specialties and age are safe. Every specialty. Those days are gone when there was something known as not fit for anesthesia. There is nothing like that at this moment. Why a 90-year-old person suffering from this disease with 5 comorbid, taking 10 drugs, he should be kicked out from the theater? No way. And we have got examples here. Saad Niaz manages all those people, more than 90, 80, and that's it. And there are other surgeons also, other physicians also, with the help of wonderful drugs, with the help of wonderful. We have got a surgical complex in Civil Hospital, Karachi, 14 theaters, and all the horrible, terrible cases of the poor people who had no money to be treated, and they come with magnified version of neglected tumors, neglected disease. They are managed there. So, nothing known as not fit for anesthesia. So, to achieve anesthesia safety goals for minimum anesthesia-related mortality, we have to invest on anesthesia provider training and working equipment and environment. Let us explore that. So, what are the factors responsible for safe anesthesia practice? Trained and qualified anesthesiologist. Again, theoretically it is fine, practically, in all our cities, there are untrained anesthetists, untrained technicians, supported by a surgeon, giving anesthesia in a hospital. That's it. What happens later on, mortality, morbidity, who cares? The surgeon pockets the money, the hospital pockets the money, a miserable amount is given to that technician, and patient is never told that he was handled by a quack. This is the ground reality right in big cities, what to talk of other cities also. Working environment, premises, drugs and equipment, and support facilities. We need to develop that to control the working conditions and the safety of our patients. And we'll have to look in our own, वो गिरबान में झांकना बोलते हैं ना, अपने गिरबान में झांक ले. So how to achieve these goals? In limited resource setting, which is in our environment. Let us go to the scenario in our country, Pakistan. So there are 2 sets of these healthcare places. One is state-owned, tertiary care. If we are fortunate, we are working there. Secondary care, district hospitals. So the scenario changes in all these places. And then primary basic healthcare units. And we are fortunate that the health minister is sitting here, who is very brave, who is Sher the Putar. पंगे लिए हैं बहुत सारे, और भी लेंगे. For the safety of the patient. Why not? We had few. Anita Ghulam Ali was one of those health ministers. She took the stand. Somebody has to. So we are fortunate in that point of view. The only thing missing that we are not Sher the Putar. हमें भी पंगा लेना होगा, हमें भी भिड़ना होगा कि साहब के यहाँ एनेस्थीसिया नहीं हो सकता, यहाँ ये चीज़ नहीं है. And then we have got another place, private sector hospitals. Of course, wonderful tertiary care hospitals. 5 star, 6 star, 7 star on the private sector. The only thing you have got to have the money in your pocket. And you can buy anything you feel like. Small hospitals, that is secondary care or small hospitals. Yes, majority of those are. Then we have got very small setups. You get a surprise. very small setup, but they are doing a job. And then on top of it, there are places which are unbelievable setup. You will just not believe it कि यहाँ सर्जरी होती है, सी सेक्शन होता है, कुछ नहीं है वहाँ, नथिंग. एक आदमी एक हाथ पे सुई लेकर आता है, मरीज को बैठाता है, एक पीठ में कुछ एक सुई चुभोता है, और उसके बाद फिर जल्दी जल्दी ग्लव्स पहन करके खड़े खड़े भाई लोग सी सेक्शन कर देते हैं. राइट हियर इन सिंध, राइट हियर इन पेरिफेरी ऑफ पंजाब, राइट इन गिलगिट, एंड आई हैव सीन दैट. यू जस्ट हैव गॉट टू गो एंड सी दैट. कोई खुफिया बात नहीं है ये. अख्तर वही साहब, अस्सलाम वालेकुम, वेलकम. वेलकम. नहीं, अभी आपका जलवा अभी नजर आया. So these unbelievable setup are ground realities. You only have to see it, and things are happening there. Anesthesia is happening there, and you get a surprise that it is not only the spinal anesthesia which is happening there into this unbelievable setup right in Thatha, right in periphery of Karachi, because we do camps, and you keep on seeing that. They perform general anesthesia by the misuse, disuse, horrible use of ketamine, along with some more drugs. They're doing it. I saw that in Kabul, ketamine anesthesia. I spent few weeks, many years before, and that was happening there. But again, at that time, there were these people who did not allow anybody, male, this and that. So, those of Taliban were there. But there are no Taliban here. It is happening here in those unbelievable setup. And then on top of it, we have got few regulatory bodies for quality control and registration, known as Pakistan Medical Dental Council. You are all hopefully registered with them. If not, get it done fast. Pakistan Nursing Council for all the nurses. Healthcare Commission in all the province. We have got wonderful Healthcare Commission, but there is a big but there. And then newly formed Health Allied Registration Council in Islamabad. They will register all the paramedics. And then a big elephant known as DRAP, Drug Regulating Authority. We face it all the time. And they are regulating bodies. So they do everything except regulating. The availability of essentials of safe anesthesia practice, that is safe surgical practice also, is very erratic and non-standard operative procedure in spite of all these regulatory bodies. That is the point to note, that with all these regulatory bodies, all these things are happening. We have got rules and regulation of every variety. We hate to implement it. We hate accountability. So things are around there. And of course, this is due to unethical and non-SOP practice by stakeholders. Who are the stakeholders? Me and you also, along with Sarkar, along with hospital owners, along with a lot of people around. But there is a regulatory body for them who does not do anything. So we are suffering from there. And then, of course, lack of money and the resources. The budget for the health is minimum in South Asia. Padosi mulk jitne hain, all the countries, they have got big budget. We have got less than 1% of GDP for health and less than 2%, that is 1.8% of GDP for education. So the health and education, which are most essential, it is not available. So chronic lack of money. And then on top of it, most of this money, around 80%, evaporates from the health budget. उड़ जाता है, बाला ही बाला उड़ जाता है, नीचे तो आता ही नहीं है. Saad Niaz has taken few stands. Salute to you, sir. But again, this is a chronic disease which we are suffering as a nation, that in all the province, money from the health budget evaporates. मैं करप्शन की बात नहीं कर रहा हूँ, उड़ जाता है. और ये अर्बन एंड रूरल दोनों जगह से होता है. So what needs to be done? Number one, strengthening of anesthesia workforce. Anesthesiologist trained and qualified, and his assistant, that is God's blessing. Fair remuneration and incentives, which is the most important part. अब चवन्नी अठन्नी में गुजारा नहीं होगा. Good money at this moment. PG residents are paid 80,000 or 90,000, which is peanut at this moment in this horrible economical condition. So that needs to be reviewed fast. There is no shortage of money. The only thing that we have got to put a lid on those evaporators. जो उड़ जाता है पैसा, उसके ऊपर ढक्कन लगाने की ज़रूरत है, ताकि ये पैसे हैं. You don't have to ask for more money. It is there. And of course, we see examples of evaporation of these funds or leak of these funds in billions when it is diverted to purchase some robots or to give it to somebody whom I love. So I would like to give them few billions of rupees because I like the face of that organization, that person. Advocating anesthesia autonomy. It is a must. It must be autonomous, otherwise किसी के थल्ले आकर के अंगूठे के नीचे आके काम करना मुश्किल. And then facilitating access to educational resources, that is CME and TBD, that is our job. Next 2 days, we will be doing some CME and CPDs also. And then quality teaching and training program at busy tertiary secondary care units and training anesthesia assistants. So all those fortunate people working at any place where you can train, please train. ज़रूर ट्रेन करें. अपनी तालीम, अपने हुनर को फैलाइए, बांटिए. इससे पहले कि आपका ट्रांसफ़र हो जाए फ्रॉम दिस पार्ट ऑफ द गैलेक्सी टू दैट पार्ट ऑफ द गैलेक्सी, जिस पर हमारा और आपका ईमान है. वी आर गोइंग टू मूव. We are going to move one day suddenly, and we know it. So why can't we spread our knowledge, our skill to the people so that to produce anesthesiologists and to produce assistant. And more teaching slots should be made. There are so many head of the departments are sitting here across the country, from Peshawar, from Lahore, from Karachi. Why can't we produce more teaching slots? Why can't we invite more people to be trained? Because we are short. And we will remain short because the Western world, they take them and give them job. The backyard countries, they offer them good money and the glamour of Makkah and Medina. So who will not like to go to Makkah and Medina and money? They go. Who the hell I am to stop them? So keep on producing. More, train more and more people. Now, of course, good remuneration is a must. A starving anesthetist with not learned anesthesia. A starving population is least interested in democracy. So give them more money. And professional bodies like Pakistan Society of Anesthesia must contribute. And this is one of the platforms that we must have sessions in all the cities, in all the part of our country. And of course, examination board should be tough, should be lenient and tough, should be quality conscious, and we must have those QC people as such. And of course, for the private sector, honest and educated hospital administration for drugs and equipment supply, which also applies on the public sector hospitals, medical superintendents, administrators. They control the resource, and in the public sector, it evaporates from there. In private sector, there is a bottleneck there. And of course, monitoring of all the parameters which we are managing, we are very bad in documenting and monitoring as a clinician. We must do that also. And of course, where there is a will, there is a way. So the whole exercise was to shake you up, wake you up, and put a drop of desire and will and commitment for safe surgery and safe anesthesia, realization that anesthesia is as important as surgery. Unfortunately, it is other way around at this moment. And of course, all of you, me, yourself, as anesthetists, we are all peri-operative physicians. We would love to be peri-operative physicians. Thank you very much.
We are delighted to have with us today a guest of honor, Professor David Pilcher. He's a senior intensive care specialist, Department of Intensive Care, Alfred Hell, Prahan, Vice President of Australian and New Zealand Intensive Care Society, Chair of the ANZIC Centre for Outcome and Resource Evaluation, Prahan, Australia, Adjunct Clinical Professor, the Australian and New Zealand Intensive Care Research Centre, and Medical Advisor to Donate Life in Victoria. He'll share insights and inspiration with us today. Please, sir.
Assalamu alaikum. Thank you very much for that kind introduction. Thank you for the opportunity to come to your conference and come to visit your country. I'm very honoured to have taken part in teaching over the last couple of days and to come along to the anaesthesia conference today as an intensive care specialist. Our specialities are intrinsically linked and synergistic. And it is great to see many of the developments that are happening in Pakistan and for this to be part of a collaboration between our countries. I wanted to just give you a couple of slides and talk to you briefly about how intensive care practice and training works in Australia and New Zealand and how we can work together moving forward. I notice my slides have gone a bit squishy, but you'll get the idea. This is the land where we practice intensive care. On the right, you can see the beautiful mountains of New Zealand. And intensive care and anaesthesia practices intrinsically cannot function without retrieval systems that can deal with mountains. In the centre, you have Melbourne, where I work. A large, modern city. I work in a big hospital with all the services that hospital can provide, and it's very similar to the hospitals that you have here. There were a lot more similarities than there were differences when I walked around. And on the left, you have Alice Springs. Alice Springs, where my friend Paul works, is a hospital that sits in the centre of Australia and has 8 ICU beds and provides services to 50,000 people who live in an area that is the size of Pakistan and Afghanistan combined. So that ICU serves the whole of that area. And our practices have to accommodate intensive care practice in a wide variety of different geographical situations. We have a population across the two countries, and we have a lot of cooperation between the two countries of about 30 million. So it's a little bit bigger than Karachi. It's a bit smaller than Sindh, and a lot smaller in population than the rest of Pakistan. But it's a very big, geographically wide country. We have about 220 ICUs. Most hospitals have one ICU, and that ICU covers neurosurgical, cardiothoracics, all the specialities. We're about 2,500 ICU beds, and we have about 200 plus ICU admissions per year. And the reason that we know about this is because we have a registry. And that registry has been monitoring the mortality in the ICUs for the last 30 years. The slide that you can see here shows the decline in mortality that happened, was static until about 2000, and from 2000 to today, mortality has progressively declined in Australian and New Zealand ICUs. And there are many factors, but there are two important factors that have contributed to this. One is the registry and the ability for hospitals to see what their outcomes are, to see how safe their practice is, to compare their practice to the other hospitals in their region, the other similar types of hospitals across the whole of Australia and New Zealand. And it's exciting for me to see the development of the registry and similar safe practices occurring in Pakistan at the moment. I think this is an important juncture for your country and the practices of anaesthesia and intensive care, to see how the ability to have visibility of your outcomes, of your practices, will influence how things improve over the forthcoming years. The other thing that made a difference to it, was integral to our development, was the development of intensive care as a speciality. Until 2000, we had two colleges. We had a College of Anaesthetists and a College of Physicians. Both had intensive care, let's call them faculties. Those faculties came together in 2000 to create a joint faculty. But it wasn't until 10 years later that the College of Intensive Care Medicine formed itself, and formed with the support of both of those two colleges, and we still work closely together. This is the first document about training intensive care doctors, written by the Anaesthetic College in 1984. That is the very first one. By 2010 it looked like this, and now we have a very well structured intensive care training scheme that involves 6 months of foundation practice, 2 years of core ICU that must include trauma, cardiac surgery, neurosurgery. So every intensivist in our country looks after all types of patients. One day I'll be looking after a medical patient, tomorrow cardiothoracic, the next day neurosurgical. A year of medicine, year of anaesthesia, an ICU fellowship, and there's an entrance exam and a fellowship exam and a formal project. And even 10 years ago, over half of our trainees were pure intensivists. The remainder are split between anaesthetics, emergency, and physicians, with a few surgeons coming through. Today, we see about 75% as pure intensivists. And we've had the great privilege to collaborate with you in some of the intensive care training and teaching that is occurring in your country. Last year, my colleagues John and Azim came to take part and be part of the FCPS critical care examinations that occurred in Islamabad. The last few days with the basic course developed by the Chinese University of Hong Kong, we've been teaching the Beyond Basic Mechanical Ventilation course at CPSP, which I've learned lots about mechanical ventilation from the people that have been teaching, and I've learned lots about Pakistani hospitality, which is fantastic. And we've also seen the development of research that's leveraging the registry and leveraging collaboration between Pakistani hospitals. And this was perhaps one of the most enjoyable things that I saw in the last 2 days. The MEGAROX trial is a large international trial that compares two oxygen strategies in ventilated patients. It's been run and coordinated by a hospital in New Zealand, Wellington Hospital, with a large component of Australia contributing. I hope you can see there that the next highest recruiting country is Pakistan. The fastest growing recruiter of patients to this international study, which will turn out to be, when it finishes recruitment, the largest intensive care study in the world The fastest growing country is Pakistan. So these are examples of collaborations of the development of intensive care and anesthesia practice in your country, collaborations that we would like to continue to be part of. Shukriya.
And now, the movement we have been waiting for. Our chief guest, Dr. Saad Khalid Niaz, would grace us with his address. He is a Dow graduate and one of the most esteemed gastroenterologists in South Asia. He is a well-known philanthropist who is presently the interim health minister of Sindh. Please welcome him on stage with huge round of applause.
Bismillahirrahmanirrahim. I'm very grateful to the Pakistan Society of Anesthesiology for giving me this honor. And I have to share something. When Shabir Saab actually contacted me, I told him I probably won't be minister by then. I'm surprised I'm still here, but I was hoping I wouldn't be. But he said, doesn't matter, we are not inviting the health minister, we're inviting Saad Niaz, and I was really honored. Thank you so much. So I was going through a couple of things suggested in the newsletter by Professor Zayed. And having worked in this now almost 6 months, one of the specialities that are most needed in the health service is anesthesiology. We're seriously short in anesthetists. In fact, when I last met the CPSP faculty or governing body, I told them, I said, you know, you need to align the slots you have with the positions available so that we are not producing candidates in gastroenterology with no available slots and they're working right, left, and center in different fields versus such serious deficiencies in fields like anesthesia. I'm really impressed by the work that the society has been doing, and I'm not surprised because the patrons you have, Professor Tipu Sultan, the teacher of teachers, Professor Akhtar Waheed, Professor Saida, grateful to Dr. Pilcher for coming all the way from Australia. I think with the team and the foundation they laid, I can congratulate you all, Shabir Saab and now Asma and the whole team, that you've actually kept the developments going. And I have to say that our setup that we have, which is an advanced endoscopy setup, wouldn't function at all without the anesthetic support we have. I mean, it's such a pleasure, you know, it's such an ease for me where I'm not worried about what's happening with my patient because there's somebody else is looking after the stability and comfort and safety while I can focus on what I do, or the only thing I know how to do is endoscopy, really. You know, one of the problems that was highlighted by Professor Tipu Sultan is quite shocking. Is 1:300 mortality in the developing world versus 1:250,000. Gosh, the only problem is when we are sitting and talking to our patient, we are not telling them 1:300. We are telling it's 1:250,000. So quite often what we are doing, and not only in, I'm sure not in anesthesia alone, but when we are talking about different surgical procedures, we quote international figures which may or may not apply to us. And I think it's very important that we must share our experience. We should start using what our data is, and that will only happen if we are keeping, some kind of registry that you mentioned. One of the first things that Fortunately, it happened when I joined, and I suggested was registry. So we knew that there was an anesthesia registry which was not moving, so we've actually put some new batteries and got it moving, I'm told. Dr. Madhia was very happy. Along with that, we also started registries of cancer, burns, suicide. I was just looking at the literature, and the suicide rate in Pakistan is quoted by WHO is 1.1 versus very high suicide rate in some of the developing world. South Korea, I think, is 26 versus us 1.1. I'm not sure how reliable is our data. And that's where the problem is. Now, how can you handle the problem that you're talking about? Professor Tipu Sultan highlighted about the difference in the quality of people who are performing procedures in different hospitals. It can only happen if you have a credentialing system. You need to have credentialing systems where you only allow those who are able to perform certain things that should be decided by the experts within that hospital, or even if we have to have experts from outside or the anesthesia society. I think this is where we need to move. We can't allow people to just come, especially in the public sector hospitals, start doing what they want to do. Eventually, everybody will learn, and if you're not monitoring, like you said, the needle can go a little here or there, and that's good enough for the patient's misery. Sir, I beg to differ about one thing. We are not behind in health services because of lack of money. We are behind in health services because of lack of governance, because of lack of honesty, lack of integrity, lack of vision. None of this exists. You just want this thing to keep moving at a pace that it's going. Nobody wants to really change. We work in the health department where you can't penalize anybody and you can't reward anyone. Now, any one of you who's working in any private setup would know that you cannot run an organization if you can't penalize somebody for not coming to work for 11 years. I've just seen a case, 11 years, no show. I mean, ghost employee, 3 times, show cause notices, this and that, and again reinstated, notice, again reinstated. And there are some people who've been working so hard, haven't had any reward. In fact, they don't even get their bloody promotions. Excuse my language. So it's very frustrating, where you can see that it's literally very easily doable. I have challenged and I challenge the politicians here, that pick up any good doctor with some integrity, put him in the health services. I can assure you, with the same resources, 3 years, the health situation or health systems will not be recognizable. Believe you me, that's how close we are. So it's very frustrating. These 6 months have been very frustrating for me. Frustrating because, when you can see light and you can't reach, when the obstacles are ridiculous, useless, mostly easily removable. So it has, enlightened me a lot. But I can tell you one thing. The way things are, we were listening to the national anthem, and it says, Paak sar zameen ka nizam, quwwate akhuwate awam. I don't see quwwat and I don't see akhuwat. Neither. And in fact, do we have awam that's patriotic to Pakistan? How many of us? People ask how things will change. I say they will only change if we change. Don't wait for others to change. Let's start from ourselves. That's the only way this country will change. The way things are going, and I know all of you we are all, Pakistanis are one way or the other frustrated with what's been going on. But it's lack of akhuwat. See, we have no unity, no brotherhood. So in the end, all I can say, sir, is that these 6 months have taken a lot of passion out of me, which I was a very passionate Pakistani. I'm still a very patriotic Pakistani. But my passion has been taken away because it is not those who you see as corrupt who are corrupt or who are only corrupt. It's the intellectual and so-called honest corrupt that most of us cannot see are the ones that are biggest obstacle to our progress. And I think this is where we need to become more. When I say this, I tell all these people, and I see Dr. Bari sitting here, I asked all the hospitals to share their per day cost, their salary structures, and their procedure costs. I asked the charitable hospitals, non-profit making, and I wanted to take the government hospitals, and I wanted private hospitals easy because you can calculate it. The rates are available. But I'm disappointed, as I'm hoping, and I pray this is my last week. Only Indus Hospital has provided me the details that I asked them to do. None of the other hospitals have actually given that to me. Now, to me, what is the big issue? I was accused because I asked for audits. I mean, we are giving you a lot of money. Why shouldn't we ask you for accounts? Whoever you are, doesn't matter. And obviously, if we are very honest, then what is the problem giving it? What is the problem sharing the details? So I think these are the things that we all need to highlight, be aware of. Once again, thank you very much for giving me this opportunity. I'm really humbled in front of my teachers, my seniors, and I request you all to pray for our country, for all of us, and last but not the least, for the Palestinians who've been suffering in this so-called liberal world. And it seems that it's not ending and not going to end. And the so-called liberal and fair world is just sitting and watching along with all of us. Thank you.
Following this, we'll proceed with the distribution of shields to acknowledge the dedication and commitment of esteemed guest. For this, I would like to call Professor Tipu Sultan, Dr. Saida Haider, Patron PSA, and Dr. Shabbir Jumani, President of PSA Karachi, to present shield to Professor David Pilcher.
जनरल सेक्रेटरी को बुलाओ भाई
किसको
जनरल सेक्रेटरी
asma sorry
Dr. Asma Abdul Salam, please come on the stage. Next, I would like to call Dr. Nasreen Laik, President PSA Center, on a stage to present shield to Dr. Saad Khalid Niaz.
obituary, हाँ इसके बाद
It is with heavy hearts that we share the news of the passing of esteemed colleague, Dr. Kashif Anwar, who was Vice President PSA KPK Chapter. Dr. Anwar's unwavering dedication to anesthesia and his profound impact on those around him will forever be remembered. Dr. Muhammad Hamid, General Secretary PSA Center, will share few words in honor of Dr. Anwar's life and legacy.
Bismillahirrahmanirrahim. Inna lillahi wa inna ilayhi raji'un. Verily we belong to Allah, and truly to Him shall we return. So about 2 weeks back that we heard the news about Dr. Kashif Anwar. He had a coronary artery bypass surgery. And soon after that, he was extubated actually, but later on he had a very turbulent post-operative course. He was reoperated and put on ECMO, but unfortunately he passed away after a few days on ECMO on 5th February, like this month, 5th February 2024. So it was a shocking news for us as we met him in December last year at a symposium where he conducted a workshop on central line placement and its care. I can recall his remarkable ability to lead with both confidence and humility. His leadership style was not about authority, but about guiding juniors and helping them grow. He was born in 1967, graduated from Khyber Medical College, Peshawar, and achieved his specialization from Royal College of Anaesthetists, Ireland in 2006. He continued to work in Ireland till 2012 and then returned to Peshawar, where he worked in different hospitals, including Rahman Institute of Medical Institute, where he was head of the department. And his last appointment was as head of the Department of Anesthesiology at Peshawar Institute of Cardiology. Actually, he was the one who started cardiac anesthesia in private sector of KP. He was considered as a very passionate and competent person who is always willing to teach juniors. He was also a very active member of anesthesia community, and he participated in several PSA conferences. In fact, he was supposed to be joining us in this conference as well. He was also elected as a president Pakistan Society of Anesthesiologists KP chapter in 2021, and he had the honor of executive member of PSA Center as well. His contribution to anesthesia community will be remembered for a long time. He was an excellent teacher, a mentor, and a role model. May Allah subhanahu wa ta'ala grant him the highest place in Jannat and give strength and solace to the family and friends. Amin.
As we embark on this conference, it is important to acknowledge the unwavering support of our dedicated members. It's a privilege to recognize the exemplary contribution of two remarkable individuals with the Lifetime Achievement Awards. Professor Safia Zafar Siddiqui, presented with a citation by Dr. Sara Jamal, and Professor Amin Khwaja, honored with a citation by Dr. Rabia Iqtidar. Please.
Bismillahirrahmanirrahim. Ladies and gentlemen, Assalamu alaikum. It is my honor and privilege to introduce to you a remarkable woman who has dedicated her life for the service of humanity. She is none other than Dr. Safia Zafar Siddiqui, the recipient of Lifetime Achievement Award for her 33 years of excellence in anesthesia, critical care, and pain management. Dr. Safia was born as the seventh child in a family in 1961 in Karachi. Dr. Safia's journey began among the bustling streets of Karachi, where she spent her formative years. Her educational pursuit led her to Jamia Millia for schooling and later to Nawab Shah Medical College, where she pursued her medical education, culminating into her successful graduation in 1986. Driven by a passion to make a difference in patient care, Dr. Safia embarked on specialization in anesthesiology, undertaking postgraduate training in Civil Hospital, Karachi. Her dedication and commitment saw her become a member of the College of Physicians and Surgeons of Pakistan in 1990, later attaining the esteemed fellowship of the college in 2002. For the past 33 years, Dr. Safia has been an integral part of the department at Civil Hospital Karachi, ascending from a postgraduate trainee to a consultant and ultimately assuming the role of the professor and head of the department. Her contributions to the clinical, academic, and research endeavors of the department are truly commendable. She has organized multiple academic activities for the medical and paramedical staff. She has run a pain clinic and provided both inpatient and outpatient pain services. She has arranged yearly free pain camps. She is also an active member of the International Association for the Study of Pain, Pakistan Medical Association, and the Society for the Treatment and Study of Pain. She is also the former president of the PSA Karachi chapter. During the corona pandemic, Dr. Safia played a vital role both as the head of the ICU of one of the largest healthcare centers and as a mentor for medical professionals from across the Sindh and Balochistan. Among her notable accomplishments is the expansion of the 8-bedded ICU to a fully equipped 14-bedded ICU in collaboration with ED Foundation, a testament of her visionary leadership. The expansion of the ICU was much needed to overcome the shortage and provide quality healthcare in public healthcare center. As a supervisor, Dr. Safia has demonstrated exceptional leadership and has overseen the successful qualification of 43 FCPS and numerous MCPS candidates into proficient anesthetists who are now contributing to national and international healthcare. In her chairmanship, she actively engaged with the Sindh Health Minister, resulting in a significant increase in the number of postgraduate trainees from 4 to 14 every year to meet the pressing demands and challenges of the ever-evolving field of anesthesia. In the field of education and research, Dr. Safia has also achieved remarkable feats. She has successfully conducted 76 postgraduate training courses, continuing the legacy of the teaching of the department. She has published more than 25 papers in national and international journals. Dr. Safia and her team collaborated on revising the second edition of the ICU Protocol Manual, which is the first up-to-date manual in critical care. Beyond her professional commitments as a great anesthetist and teacher, Dr. Safia is cherished for her warmth, kindness, and vivacious personality. As a devoted daughter, wife, and a mother, she exemplifies balance and grace in all aspects of her life, actively engaging in extracurricular and social activities that enrich the community. Dr. Safia is an inspiration to all of us and a role model for the future generation. She has shown that with dedication and hard work, one can achieve anything in life. She has touched the life of countless patients, students, and colleagues with her expertise, kindness, and generosity. She truly deserves this Lifetime Achievement Award for her outstanding services. On behalf of the entire Department of Anesthesiology at Civil Hospital Karachi, let me take this opportunity to extend my heartiest congratulations on achieving this award. Please join me in giving a big round of applause to Dr. Safia Zafar Siddiqui. Thank you. I would like to invite Dr. Tipu Sultan to kindly give this award to Dr. Safia Zafar, along with Dr. Saad Niaz, the Health Minister. Please honor us, Dr. Saad Niaz and Dr. Tipu Sultan. Dr. Sarah?
आई थिंक मेरी सुपरवाइजर डॉक्टर सईदा हैं, वो भी आ जाए. थैंक यू.
I would kindly request Dr. Shaida Khwaja to please join us on stage and share this moment with us. Thank you very much. Last but not the least, our guest of honor, Dr. David, please join us on stage. Thank you very much.
I'm really, really proud of Safia. Safia was my first postgraduate trainee for FCPS, and she's done so well, mashallah. She has really brought up the standards, and I hope it can be kept by her bhatija. Farjad is going to be the next one in line, and inshallah he's going to continue as well as her. She has really done beautifully. I think she's really picked up very well.
For the next Lifetime Achievement Award, I would like to call upon stage Dr. Rabia Iqtidar to provide the citation for Professor Amin Khwaja.
Assalamu alaikum, everyone. Ladies and gentlemen, esteemed guests and distinguished colleagues, it is with great pleasure and privilege that we all here gather today to celebrate the remarkable career and the outstanding contribution of Professor Dr. Amin Khwaja, who is being honored with a very well-deserved award of Lifetime Achievement Award. Professor Amin Khwaja. So let's have a brief description about the remarkable contribution he has made in the field of anesthesia, who is currently serving as a professor and the head of the Department of Cardiac Anesthesia and Surgical Intensive Care Unit at the National Institute of Cardiovascular Diseases, NICVD, Karachi. He has traversed an illustrious journey in the field of anesthesia, and regarding his academic achievement, his educational foundation was laid at the Cadet College, Petaro, followed by his pursuit of MBBS at the Liaquat University of Medical Sciences, Jamshoro. So Dr. Khwaja further enriched his knowledge and skills by completing first his MCPS and then FCPS from the prestigious Institute of Pakistan, that is the College of Physicians and Surgeons. So in the year 1989, Dr. Khwaja joined the beginning of his transformative career and joined National Institute of Cardiovascular Disease in the field of cardiothoracic anesthesia. Venturing beyond the borders, he also gained a valuable experience as a registrar in the anesthesia at Meath Hospital, Children's Hospital, Harcourt Street, Dublin, as well as senior house officer at Gloucestershire Royal College, Gloucester and Guy's Hospital, UK. In the year 2001, Dr. Khwaja assumed a leadership role and provided a pediatric anesthesia for the structural heart disease. And in the next Following year 2009, he took the responsibility of catering to the need of pediatric cardiac surgical patients with a specific focus on establishing a dedicated pediatric cardiac intensive care unit, and subsequently his efforts brought results and provided in the year 2013, a significant milestone was achieved with the inauguration of separate pediatric surgical ICU in NICVD. In 2015, Dr. Khwaja, honored for his exceptional leadership role as being a part of primary percutaneous intervention team in establishing a 24-hour services for the heart care patient, for heart attack patient who are coming to NICVD, and also provided his services in TAVI procedures that are to be done as a daycare procedure in cath lab. So this is a big achievement. So he played a key role in establishing a satellite centers of NICVD, including Sakkar, Hyderabad, Larkana, and Chandu Muhammad Khan, where a big poor population of Pakistan is coming and achieving these services from the National Institute of Pakistan. That's one of the biggest contribution. Regarding his professional contribution, he extends beyond his clinical practice and has served as the General Secretary of Pakistan Society of Anesthesiologists, Karachi for the 2 tenures, and later as the President of Pakistan Society of Anesthesia, Karachi. He is currently a member of faculty in cardiothoracic anesthesia services, and as well as an examiner from both the Journal and Cardiothoracic Anesthesia from College of Physicians and Surgeons. So his research expertise is evident in his published article in renowned national as well as international journals, including British Journal of Medicine and Annals of Cardiothoracic Surgery. So his contribution is not limited to the professional life only. As a proud father, he is responsible for the upbringing of his 3 daughters, each excelling in their fields remarkably. So ladies and gentlemen, put your hands together for Dr. Amin Khwaja for his lifetime dedication, leadership qualities, and contribution to the field of anesthesia, as well as Lifetime Achievement Award. I'm pretty sure that his legacy will undoubtedly inspire the future generations to come. So now I would like to request who has to come on the stage for presenting this prestigious award, Professor Zia Ashraf, Dr. Hamid from AKU, and Chief of Guests, Dr. Saad Niaz and Dr. David. May I request you, sir, to please come on the stage, and Dr. Nasreen Laik. Thank you very much. In your big claps.
We also have other esteemed guests from Australia, Dr. John Botha and Dr. Asim Shah. We would also request them to please come on stage for this citation and for this.
Thank you, everyone. Before we conclude, a heartfelt vote of thanks will be delivered by the Treasurer of PSA Karachi, Dr. Talal Ahmed, expressing our gratitude to all who have made this event possible.
Assalamu alaikum and a very good evening to a very good morning to the esteemed chief guest and the guest of honor, and to all my seniors and colleagues. As a treasurer of Pakistan Society of Anesthesiology, I would like to express my sincere gratitude to all our distinguished guests, esteemed speaker, dedicated attendees, and hard-working organizers for their invaluable contribution towards making this conference a remarkable event. I would also like to commend the efforts of our organizing committee for their meticulous planning, tireless dedication, and flawless execution of the event. Their unwavering commitment to excellence has been instrumental in creating a platform for meaningful interactions and professional development. Furthermore, a special thank you to all our sponsors for their generous support, which enable us to host a memorable and impactful event. Your contributions have been invaluable in advancing our mission and promoting excellence in the field of anesthesiology. Last but not the least, I would like to thank our members for their continuous trust and involvement in our society. Your passion for enhancing patient care and professional development in the field of anesthesiology is truly inspiring. In closing, I'm honored to serve as the treasurer of such a prestigious organization and look forward to our continuous collaboration and success in the field of anesthesiology. Thank you once again to everyone involved for their dedication, passion, and unwavering commitment to excellence. Thank you very much.
Please be seated. We'll inaugurate our scientific exhibition.
Thank you so much, everyone, for joining us today. I would like to invite the guest of honor, the chief guest, and the senior members of the cabinet, and to please proceed to the foyer for inauguration of our scientific exhibition session. The senior members and faculty, please proceed to Dumpuk for high tea and refreshments, and all the participants, please proceed to the governor's room downstairs. Thank you.